So at a youthful age of 41, I went through something pretty serious. It took me totally by surprise. I had to have open heart surgery. And I remember being discharged in a complete daze with all this hard to understand paperwork. And even though I had good insurance, access to great hospitals, I felt totally discouraged. I remember thinking about my 3 small kiddos at home and my future as their breadwinner. I felt totally overwhelmed, and I had good reason to be. Because the moment I left the hospital doors, I was out of their care. I was off the grid. Everything moving forward regarding my progress was now in my hands. From managing a year-long series of complications, to rescheduling hospital visits, to filling out paperwork, attending therapies, all of this now was on my shoulders. And the truth is, I needed people to help me through this. I needed proactive people. I needed people to help me get to my cardiac and physical therapies. I needed people to help me pick up my meds, to hold my hand, to help me change habits, and sometimes even kick me in the pants. Now, my wife was chief of this. Not just because she's on the ball and great with X, Y, and Z. More importantly, she was an effective caregiver for me because I know her, and I trust her, and she knows me. She knows my fears, my insecurities. She knows my excuses. And I learned a valuable lesson. If you're going to manage and control a chronic condition, you have to have someone right by your side that you can trust. Now, let's take type 2 diabetes. This is another chronic condition that affects a massive amount of people in America. In fact, 120 million people in this country have diabetes or prediabetes. That is 1/3 of the population. It's a huge number. You probably know someone that has it. And when not managed, it goes on to create things like strokes and amputations, heart disease, kidney failure, a whole host of just awful things. Worse, a disproportionate number of these patients live in underserved communities. Communities that are predisposed to chronic disease. Communities that have been let down time and time again by the healthcare system, creating this general mistrust towards medical care. So when they're rolled out of the hospital door and they're off the grid, they instinctively avoid healthcare. At which point, are they following discharge orders? Are they eating better? Are they getting healthier? Who knows? They are bearing the burden of their chronic disease alone, filling out paperwork after paperwork at disconnected offices, being seen for 8 minutes over here, 10 minutes over there, and all the while by people they don't even probably trust. And that's assuming they're going to the doctor. And you can't just see someone for an hour or a day or a week and expect lifelong change. And managing a chronic condition is all about lifelong change. So most people in underserved areas, they wait till things get desperate, they head straight back to the ER to receive expensive care for ever worsening conditions. All because they had no one in their life that they could fully trust with something as personal as their chronic health. My name is Parker Dale. I'm the founder of an organization called The Root Cause based in Dallas. Now, The Root Cause fills this trust gap in chronic disease management in underserved communities. We provide that trusting, proactive community for when patients are off the hospital grid. We meet people where they live, work, and pray. And look, we know the system is broken, but we are determined to help fix it from the bottom up, building trusting relationships at the neighborhood level to help improve a person's health. Because after all, the system treats people. The community changes people. So we start with a trusted place. Now, most people in our areas do not go to a primary care physician, but we do know where they go 52 times a year, their local church. Then we build a team of trusted people, starting with the local pastors. Now, given our shared Christian DNA, we're able to establish relationships with the local pastors fairly quickly. And then these pastors, they serve as our influencers to help us find and identify potential caregivers already based in the neighborhood. Then we take the caregiver, we put them through an extensive training, peer-to-peer training, focused on trust building, where they learn valuable life skills like active listening, authentic curiosity. We also professionally train our caregivers in the management of chronic disease, mental health, and social determinants of health, which are those social economic factors that impact a person's overall well-being. So instead of paperwork, a person gets a caregiver, a local, trusted caregiver. Instead of feeling like a number, they feel valuable, maybe even for the first time. And this simple approach opens the door to amazing life change and self-improvement, and it delivers results in ways that our fragmented healthcare system simply can't. Now, we've been working in the South and West Dallas neighborhood since October 2019. We are currently helping 100 people manage their disease. In 2020, we saw a 40% reduction in blood sugar levels. 40%. That's with no therapeutics, 100% caregiver-driven, in the middle of a pandemic. For those of you that aren't clinicians, these are crazy good numbers. And we know that there's over 200 churches in South and West Dallas alone. So we're talking thousands of people that we could impact with that 40% reduction. But what if we scaled bigger? What if we scaled to DC, to LA, or to rural Alabama? Now you're talking about hundreds of thousands, if not millions of people that we could impact, because pastors and influencers in the church community already know that to really drive impact, you've got to have a deep-rooted spiritual connection with an individual. And that is what we do. And that is what we are going to do on a much, much bigger scale. So this isn't all just about medical transformation. This is also emotional life change, right? Last year we had a big screening in South Dallas. I'll never forget, this lady walked in from the back. She had her small child with her. And just like this, she was standing, with, why am I here? Who made me come to this? So I sent a caregiver over to talk to her, and she finally came over to the screening station. We explained the process to her, and she's like, whatever, She put out her finger to get screened. Now, when we screen for diabetes, anything 6.5 or higher is full-blown diabetes, 6.5 or higher. Veronica's was 11. Bad off. We told her this, and that defensive guardedness that she had just dropped. She melted, and she started crying, and I mean like crying. She was asking questions like, what does this mean? Am I going to die? What about my child? We assigned a caregiver to her. Over time, they built a relationship. The caregiver didn't sling paperwork at her or chastise her for not eating this or eating that. She listened to her. She asked good questions. That relationship grew. The caregiver got Veronica established with a local doctor. The caregiver got Veronica to start coming to our life group meetings, our monthly community group type meetings that focus on diabetes and hypertension. Sometimes people just come for the fellowship, quite frankly. So at the end of the day, Veronica got a trusted caregiver who's now her friend. She got a doctor, and she got a community, all of which help her effectively manage her condition. In fact, the last time we screened her, she had dropped from 11 to 7. She's not out of the woods yet, but she's making progress. Better off. She's now a root cause caregiver. So she's pouring back into her neighborhood the same way her caregiver poured into her. She said it best when she told me once, the root cause experience changed my life completely. I can now manage my situation. My numbers are good, and I'm in a much better place spiritually and in the neighborhood. Trusted, local caregiving. This is the root cause. Thank you.